Let's discuss a burning question today. What do you do for a small and receded chin? You go for chin implant or do you do a genioplasty? I'm Dr. Shreya Krishna, your trusted oral and maxillofacial surgeon from New Delhi. Today I'll discuss all about chin implants and genioplasty, the pros and cons and the correct indication for each. So what is a chin implant? A chin implant is a medical grade device which is shaped like a chin that is basically inserted from the outside in between the skin of your chin and the deeper layers of the chin. What a chin implant does is, with a very small incision, it gives certain amount of projection to a small chin and in some cases even gives a length. What is genioplasty? Genioplasty is when we completely detach the chin bone from the rest of your jaw and reposition it either in the front or little downwards, backwards, sideways. It is done from completely inside the mouth and leaves no scar. Let us discuss the indications of each procedure, implants and genioplasty. So chin implants is chosen when the magnitude of the problem of a receded or small chin is not too much. The cutoff for doing an implant is when the discrepancy is something around 5 millimeters. So whenever the chin is small, only around by 5 millimeters, you need some lengthening and maybe you even need to make the chin little broader, implants can be considered. When do we consider genioplasty? Genioplasty is considered when there is anything and everything to do with the chin, basically. So genioplasty can also be done for small amounts of advancement or lengthening. It can also be done for large amounts of advancement and lengthening. It can be done for asymmetry correction. It can be done to make the chin broad. It can even be done to make the chin narrow and more V-shaped. It can be done even as a shaving procedure. In short, genioplasty is applied across all kinds of needs of the chin. Now that you know what implant and what genioplasty is, let's discuss before you choose what is the pros and cons of each of these. Let's start with implants. So chin implant, the pro is first, it is a very short procedure. It can be done in the OPD setting in the office. And third, there's very minimal downtime. Let's discuss the cons. The first is it leaves an external scar. Second, it is only applicable when the amounts of augmentation required are lesser. And third, sometimes you may even be able to feel the implant in your soft tissues of the chin. Let's now discuss the pros and cons of genioplasty. The pros of genioplasty are first, it gives you permanent results. Second, it can correct all deformities of your chin. And third, it hardly has any chances of failure and you don't feel anything from the outside. The cons of genioplasty are A, it requires a higher downtime and more recovery period. Most of the time, it is best done in the hospital setup under general anesthesia. I hope this video has been able to roughly narrow down the choice between an implant and a genioplasty when you're looking for that projected chin. For more information, please also watch my video dedicated to genioplasty. Thank you.